It was very nice meeting you all for the first time at our plenary on rapport. One thing I wanted you to be able to review was that, as I mentioned in the class, I think rapport for most of us doesn't come naturally. Unless you're in the sales force or you did a short stint trying to work in the merchandise business. Rapport is something you have to practice, and as I mentioned, when you keep on memorizing the Krebs cycle over and over again, and you reapply it in pharmacy, and you reapply it in clinics, and then you reapply it in trying to figure out the pathophysiology of disease and how it presents, you'll get pretty good at the Krebs cycle after a while, so it just rolls off. Even if you forget it, you can go back, memorize the 6 chart carbons and where each one goes off, and you'll kind of get it again. Well, same thing with rapport. Unless you constantly introduce yourself with the title, hi, my name is whatever it is, and then I'm a medical school student. I usually will get used to say, hi, I'm Dr. Segil. Welcome to my clinic. Mrs. blah, blah, blah. What can I do for you? Or how can I help you get better? And if you stumble with the first words that you say as soon as you open the door, then already you're generating that idea about, well, why is this person stumbling? Or, oh, I get it, he's a first-year medical student. Or, oh, I see, they're residents, that's why they're just practicing. So even then, if you give the energy of the meeting a stumbling block, then it technically will be hard to develop rapport. Or you'll develop the wrong kind of rapport. Like in the film, if you do nothing but look at your notes, or in private practice, it's a very good tendency to want to just type on the computer and not even make eye to eye with the patient, and occasionally just go like this, say, oh, I see, and just go down the line of chief complaint, history of present illness, review of systems, family medicine, family history, past medical history, surgical history, and go down the line and not even wink at the patient, not even give them acknowledgement. Well, just think, if that was your mom going in for a severe disease, or your father or sibling or a significant other that was being seen without you there for a significant disease, and that person was this, what would you think? You'd think rude. I'd say get out of that office as soon as possible. So again, it's very important that you establish some ease of introduction. And it's different when you look in a mirror and you introduce yourself in practice. There are subtle things that can happen in a room. I just saw about 31 patients today, and each patient was different. Each parent was different. Each level of suffering was different. So every time you open a door, it's not just, hi, I'm Dr. Rick, how can I help you? You have to see what is behind the door, the energy in the room. And this is the beauty about Eastern medicine, is there's a lot of weight put on energy. There's a lot of information that's garnished even before you get into the room, even before you speak. You can get a gestalt about, is this person suffering this? Is this person looking you in the eye? Is this person cowering? Is this person shivering? So just those subtle cues, even before you introduce yourself, the subtle cues are very important. What more, your introduction, the way you represent yourself in voice is also so important. So the way I usually would do it is I would practice over and over again with everybody. I would just make a joke out of it, and what I want you guys to do is actually take one day, and everybody you walk into, as funny as it may sound, everybody you walk into or introduce yourself to or run into, friends, you go ahead and introduce yourself. Hello, my name is blah, blah, blah. I am a first-year medical student. I am a third-year medical student. How can I help you right now? Or you get through your spiel. You know, there's in business, there's these 30-second elevator speeches that you come up with. And I think if you keep on practicing, it just rolls off the tongue. If all you have, as I mentioned to you, in an average visit of 31 patients, if all you have is 7.5 minutes to figure out something and come up with a diagnosis and a plan, and then move away or start to end the conversation, you've got to be very succinct about what you share with the patient. So, not that I'm trying to get my patients or get out of the room quick, but if you have a go-to method that works that not necessarily unleashes, but introduces yourself in the most subtle way, yet gives the most succinct amount of information, that's the perfect setup for your introduction. You're not going to be able to figure it out unless you keep on introducing. So I would say, take one day, introduce yourself to everybody in the same way. You write it down on your own. And as I mentioned, memory cards, next time I expect everybody to have their own cards, their own set of cue cards as far as those elements of the history of present illness, chief complaint, elements of the exam. I think it's important. We're going to be talking about that next time, how to break down an HPI. But for now, the most important thing that we'll learn and practice is rapport, developing rapport. It is very important. As subtle as it seems a topic, it's very important and is the foundation for everything else thereafter. I really think you can make and break your practice depending on how relaxed you seem in the room. And if you're tense because you're stuttering on your intro, just like sales, if you're stuttering on your intro, you lost the sale. Well, same thing. If you are stuttering, it's going to take you longer. You're not going to lose a sale with your patient. They're still there. They paid their copay. They want an answer. They want antibiotics or whatever. They're coming in for pain control or in a plan at least. If it takes you longer to get there, the other 30 patients that are behind that patient will be more pissed off, and it'll be harder to quiet them down, introduce, get the rapport going. So please try to practice it at least for one whole day. Everybody you run into, I don't care if it's the cafeteria lady, some guy at the corner, somebody that you're sharing the bus stop with, your friends when you're studying, please try to practice that intro every time and leave it at that. You don't have to get into the whole history. But I think if it rolls off your tongue, then it becomes second nature to you. Start feeling better, okay? I'll talk to you again. See ya. Thanks. One of the most important things I can tell you is that when you're running a fast clinic, rapport is always important. Sometimes when you're going from room to room, if you barge in and you're still thinking about the last patient or how to end your day, it'll rub off on the patient that you're going to see. So what I usually do, this might be something that you keep with you until private practice. You do a deep breath in. Well, you take a pause. You can do it while you're reading the chart before you enter. Take a deep breath in. 1, 2, 3, 4. You hold it for about 7 seconds, and you can count in your head. Then you deep exhale out over the course of 1, 2, 3, 4, 5, 6, 7, 8. So you can tell it's inhale for 4, hold gently for 7, exhale over 8. Those of you who want the scientific explanation, anytime you hold your breath or you slow down your exhale, it always turns on the parasympathetic response. And I'll let you read on that. Parasympathetic response, serotonin, relaxation therapy on your own. So in yoga we call it pranayama. It's a study of breath, and when you control your breath, you control all the chaos around you. Technically you can't really control chaos, you can only control what's going on here. And what better way than breath? So 4, 7, 8. Look it up, I'll put a link here, but it would be great to ground yourself, erase what you just came from, erase what you're going to go to, and just put yourself in the moment of the next patient coming to see you. Hello.